I have a silver filling in the back, but we don't really do them anymore in our practice. But it might not be why you think. So, silver fillings, dentists, we call them amalgam fillings because they're an amalgam, a mixture of a bunch of different materials, and it's an alloy. But there's been a lot of bad press for amalgam silver fillings, both on social media and in the news, because they contain mercury. And mercury is definitely a toxic chemical by itself. So you really don't want mercury getting into your system, but the debate is how much mercury actually gets into your bloodstream when you have one of these fillings. Now, a lot of us would argue that removing the silver amalgam filling and creating all this vapor as you drill it out could potentially be more exposure to mercury than just having one in your mouth in the first place. So I don't personally agree with just removing all your silver fillings because they're toxic and it's the reason why you feel sick all the time. I don't think that's really true. Anyway, silver fillings have been great for a long time. They last a long time. And before dental composites, which are the white fillings, got a lot better and advanced, the silver fillings far and away lasted longer. So there's lots of people, I see people every day in our practice with amalgam fillings that are 30, 40, even 50 plus years old, and they last. The big reasons why we see them fail over time are similar to the same reasons why we see a composite tooth-colored filling fail. It's because of a crack in the tooth or new decay, a cavity getting underneath of the filling. So we don't really see a lot of difference nowadays in the longevity of the two, and the main reason why we're not doing them anymore is just because people don't want something dark in their tooth. A lot of people don't care, some older people, people who want something that lasts, but I would say in the last 6 years in our practice, I could probably count on one hand the number of people that even mentioned getting a silver filling, let alone wanted it over top of the tooth color filling. We really just don't do them, not because I don't like them. We did a ton of them in dental school and residency, and they last a long time, but nobody wants something dark in their tooth, even if it's a back tooth. People just, if you laugh loudly or you smile big, somebody just doesn't want to see something dark back there. So we don't do them anymore, which is kind of a shame, but it's the way things go. And the composites nowadays are much better, so they're able to last, if it's done very well and kept dry and isolated while you put it in and you seal it and bond it, should last just as long or longer as the old silver ones.